Not every chest pain means you are having a heart attack, but many heart attacks have started with chest pain that people ignore. Probably just gas. Maybe I'm just tired. The mistake is not in the pain itself, but in ignoring the warning signs of a heart attack. And when you finally realize what's happening, it could already be too late. As a doctor, I've heard the same line from too many patients. "Doc, I think it's just bloating. It doesn't feel like heart attack symptoms." Then a few days later, they end up in the hospital in critical condition. Some never got the chance to say their last words. Chest pain is common, but it's also one of the most dangerous symptoms in cardiology. It could come from your stomach, your muscles, nerves, or lungs. However, it could also be a warning sign of a heart attack. Here's the real issue. Most people don't know when chest pain means heart attack and when it doesn't. Some think it's nothing when it's the early signs of a heart attack. In this article, I'll share with you 5 signs of heart attack you should never ignore, because they might be the first signs of heart attack, and possibly your last warning before it's too late. Sign 1. Chest pain with shortness of breath. A dull, widespread chest pain with no precise location accompanied by shortness of breath is one of the early warning signs of heart attack that people often overlook, especially in seniors and women. Many describe it as a feeling of not getting enough air, even while sitting still, or experiencing unusual fatigue after doing something as simple as walking a few steps or climbing the stairs. According to research from the American Heart Association, this could be a sign of angina, a temporary lack of blood flow to the heart that signals signs of a heart attack might be approaching. What's particularly dangerous is that women often don't experience clear chest pain. Instead, they're more likely to show heart attack symptoms in women, like shortness of breath, nausea, or overwhelming fatigue symptoms, are easily mistaken for stress anemia or just aging. Most patients never imagine that shortness of breath could be heart-related. However, if that breathlessness is accompanied by chest tightness or rapid fatigue during exertion, that's a serious red flag. And sadly, many only realize it once they're already in the ER. The next sign is just as common, but often mistaken for a pulled muscle or emotional stress. Stay tuned. Sign 2. A heavy, tight pressure, like someone squeezing your chest. If shortness of breath makes you feel like you're low on oxygen, then the feeling of pressure or weight on your chest is the classic sign of a real heart attack. Many patients describe it as like someone sitting on my chest, or something tightening and refusing to let go. This is a textbook description of stable angina condition where the heart doesn't get enough blood temporarily, often triggered by physical effort or anxiety. But it can also be acute myocardial infarction, also known as heart attack pain, a sign. That part of your heart muscle is slowly dying from lack of blood supply. The pain is usually not sharp or stabbing. It's more like a dull, crushing sensation that lingers and feels like it's squeezing from the inside. And if the pain doesn't go away with rest, that's a severe warning. According to the Mayo Clinic, a heart attack can also come with other heart attack signs like sweating, dizziness, or nausea. And while you might think it's just stress or a stomach issue, Signs of a heart attack should never be dismissed just because the pain isn't screaming loud. Coming up, I'll cover another warning sign, not in your chest, but a quiet cry for help from your heart. Sign 3. Pain spreading to the shoulder, neck, jaw, or left arm. Not all chest pain is limited to the chest. In many cases, heart attack symptoms appear in entirely different areas. This makes it easy for both patients and even doctors to miss the early warning signs. Pain that moves to the neck, jaw, shoulder, or down the left arm is a serious red flag, especially in older women or people with diabetes. For them, heart attack symptoms in females are often not as apparent as they are in men. It might feel like a mild ache in the shoulder, a sore jaw, or numbness in the left fingers. All of these can be signs of a heart attack in women. In men, heart attack symptoms in men are more likely to involve chest tightness. But if the pain spreads to the left arm, worsens with activity, and eases with rest, it is likely angina. This is a warning that the heart is not getting enough blood. If left untreated, it can turn into a real heart attack. According to the American Heart Association, around 30% of heart attack patients never feel chest pain at all. Instead, they experience pain in areas such as the neck, jaw, or back. So what about those symptoms that seem like just stress, such as nausea, cold sweat, or mild dizziness? That is precisely what I will cover in the next sign. Sign 4. Chest pain with sweating, nausea, or dizziness. Not everyone who has a heart attack clutches their chest and collapses like in the movies. In reality, many early heart attack signs show up in much subtler ways, such as nausea, cold sweats, or a vague sense of dizziness. These symptoms are often mistaken for stress, low blood pressure, or even a cold. It becomes hazardous when people assume they are having a panic attack. Even though panic attack versus heart attack may look similar with symptoms like a racing heart, shortness of breath, or dizziness. A panic episode often comes with a clear feeling of fear and usually passes quickly. But when nausea and sweating come with chest pain or discomfort, especially in someone with high-risk factors like age, chronic illness, or smoking, it is likely a typical case of pre-heart attack symptoms male. According to Mayo Clinic, nearly 45% of women hospitalized for heart attacks reported no chest pain at all. Instead, they felt exhausted, lightheaded, or nauseated, symptoms that are among the easiest to ignore. Your body could be sending out one final call for help before things go too far. If these signs come along with chronic fatigue, swelling in the legs, or numbness throughout the body, then this might not just be a heart attack. It could be an early sign of chronic heart failure. I will explain that next. Sign 5. Chest pain with leg swelling or lasting fatigue. Not all chest pain is intense. Some signs are incredibly quiet but dangerously subtle, such as unexplained fatigue, swelling in the limbs, or a persistent heaviness in the chest. These may be early signs of heart failure, when the heart can no longer pump blood effectively, causing fluid to build up in the lower extremities. Many patients who were later hospitalized for a heart attack had already experienced days of swollen legs, shortness of breath, while lying down, or sleepless nights from the inability to breathe deeply. However, they brushed it off as a result of aging or a lack of exercise. In a study by the American Heart Association, more than 30% of patients with heart failure said they were initially misdiagnosed with arthritis, depression, or digestive issues during the first few weeks of symptoms. That's why if you experience mild chest discomfort along with swelling and fatigue, consider a broader range of possibilities. This might not be an isolated symptom. It could be the onset of heart failure signs and symptoms. And if you have a history of high blood pressure, diabetes, or previous episodes of mild chest tightness, then heart attack warning signs may very well be hiding inside those mild symptoms. Some pains won't knock you down. They show up quietly, knock once and vanish as if they were never there. But those are often the most terrifying signs of all. Because not every chest pain is a heart attack, but many heart attacks begin with a chest pain that's brushed off. You've just seen 5 quiet warning signs, 5 life or death messages your body may have sent, but that we've learned to ignore. A bit of fatigue, a slightly heavier breath, a passing tightness in your chest. They may seem harmless, but they could be early warning signs of heart attack, a silent cry for help from your heart. We tend to delay action thinking we still have time, but your heart doesn't wait. And when it stops speaking, you no longer have the chance to listen. Don't trade one moment of doubt for a lifetime of regret. If you or someone you love has ever felt these signs, don't guess. Get checked. And if you're wondering whether your chest pain is caused by heart issues or simply indigestion, watch the following video, because the line between them is thinner than you think.